Chapter 12, Posture, Movement, and Performance Assessments. We're going to keep this one relatively short because there are a ton of videos that I've recorded for you on the overhead squat assessment, which is I would say the primary assessment that NASM is going to test you on. Thinking through the reasoning for things, right? We're going to start obviously with static posture. Static posture is typically assessed in the standing position, and it's used to identify the three postural distortions that we see: pes planus distortion syndrome, upper cross syndrome, and lower cross syndrome. Pes planus distortion syndrome is characterized by flat feet, knee valgus, and internally rotated and adducted hips. So that flat foot, we're not creating a good arch, and then as a result, the feet will be flat, the knees will cave in, and the hips will rotate inward and adduct as well. Lower cross syndrome is characterized by an anterior pelvic tilt and excessive lordosis of the lumbar spine. So that's typically caused when we see that the hips are tilted forward, and we have a tightening of the hip flexors and an over extension of the glutes, causing reciprocal inhibition. This is a common pattern, obviously, of the lower body and the hips. Upper cross syndrome is characterized by a forward head and a protracted shoulder position. So these are our three big static postural distortions that we see. The overhead squat assessment is the first movement assessment performed for clients and serves as a basis for all other movement assessments. It evaluates dynamic posture, core stability, and neuromuscular control of the entire body during a squatting motion. During the overhead squat assessment, notate all movement impairments to identify potential muscle imbalances. From the anterior view, look for feet turning out or the knees caving in. From the lateral view, look for the low back arching or an excessive forward lean of the torso, or potentially arms falling forward. The single leg squat assessment should be used by clients who have performed well in the overhead squat assessment, or if the fitness professional is considering the single leg exercises in their programming. This test is a good assessment of an individual's ability to balance, which is an important functional consideration for activities of daily living and exercise programming. So obviously start with the bilateral overhead squat assessment, and then if they perform well enough, then you can look into doing a single leg squat. Pushing and pulling assessments evaluate function of the upper extremity and concurrent core stability. They can be used as an intake assessment or an integrated part of the actual programming. When performing the pushing or pulling assessments, look for the following movement impairments: low back arching, which we would see from the lateral view, shoulders elevating, or a head jutting forward. Performance assessments can be used for clients looking to improve athletic performance and measure maximal strength, power, muscular endurance, as well as speed and agility. The push-up test measures muscular endurance of the upper extremities during a pushing movement. The bench press and squat strength assessments measure maximal strength capabilities. These tests are advanced assessments for strength-specific goals and may not be suitable for clients with limited experiences with resistance training. The vertical jump and long jump assessments are measures of lower body power. And the left test is designed to test lateral speed and agility. Left is considered an advanced assessment for speed and performance-specific goals. The 40-yard dash assessment evaluates reaction capabilities, acceleration, and maximal sprinting speed. The pro shuttle, the 5-10-5 test, assesses acceleration, deceleration, agility, and control. This test is most appropriate for clients with athletic goals seeking to assess agility and sprinting speed. So looking at all of these, beyond those static postural assessments and the overhead squat assessment, once you start to get into some of these other ones, maybe the push-up test is a little bit lower hanging fruit, but that's going to look more at the muscular endurance. The bench press, the squat strength assessment, some of these jump tests, some of these lateral, the agility and speed testings are probably for a little bit more advanced clients. All of these assessments need to be sequenced in a specific order to help guarantee accurate results. Non-fatiguing assessments, such as a pre-participation health screening and physiological and body composition assessments, should be conducted prior to posture, movement, cardio, and performance assessments. Fitness professionals should always use caution when implementing movement and performance assessments with their clients. Certain populations, such as overweight or obese youth, older adults, and prenatal clients, may need to modify or avoid certain movement and performance assessments. Some assessments are not applicable because they do not relate to the client's goals. Other assessments may cause safety concerns. So just be specific, be intentional in the assessments that you're performing and what your desired, what you're looking to actually assess. Again, so then looking through some important concepts, we talked about the pes planus distortion syndrome. What we're going to see in this is that statically the ankle joints will be collapsed inwardly. The knee joints will be valgus, which is a knock-kneed and internally rotated. And then the hip joints also will be internally rotated and adducted. When we look through that, some of the potential overactive muscles potentially could be the gastrocnemius and the soleus, the adductor complex of the inner thighs, and our hip flexors may all be overactive. And then potential underactive with this would be anterior and posterior tibialis, our shin muscles that are assisting and helping us to develop a strong arch, as well as our glute max and glute med. Looking at the static assessment of the lower cross syndrome, some of the static position, what we're going to see is that the hip joint is flexed forward, anterior pelvic tilt, and we have a excessive lordosis overextension at the lumbar spine. Potential overactive muscles in the lower cross syndrome would be the hip flexors and or the lumbar extensors, our low back muscles. Potential underactive muscles that we need to strengthen and activate a little bit more are going to be the glute max and med, the hamstring complex, as well as our abdominals. And then last of the static positions are in the upper cross syndrome. These would be, in this position, we're seeing that the thoracic spine has an excessive kyphosis, which is like a flexed hunchback kind of position. The shoulders will be protracted, rounded forward, and internally rotated, and the head and neck will be jutted forward. And that is your upper cross position. The potential overactive muscles in this position would be your pec major and minor, so your chest, your levator scapula and sternocleidomastoid. These are the muscles in your neck that potentially will be drawing your head forward, as well as your upper trapezius, upper traps. Potentially underactive muscles that we'd like to strengthen here are the mid and lower traps, our rhomboids, so those muscles in the mid and lower back, as well as our deep cervical flexors, muscles deep within the neck that will help us from letting the head jut forward and kind of let us pull that back into somewhat of a double chin, more stacked position within the head and neck. And then going through the overhead squat assessment, I'm going to refer you to all of the other videos that are recorded here within this resource to look at all of your potential overactive and underactive muscles in the overhead squat, in the single leg squat, and the pushing and pulling assessments.